Critline Training. Critline Technology and its role in your fluid management program. This program has been developed by the Fresenius Renal Therapies Group. It is intended to provide pertinent data to assist healthcare professionals in forming their own conclusions and making informed decisions. It is not intended to replace the judgment or experience of the attending physician or other medical professionals. The treatment prescription is the sole responsibility of the attending physician. At the end of this presentation, you will have a better understanding of the value blood volume monitoring through Critline can have on your patients. You will have the opportunity to observe the impact of Critline data through the review of a video case study. And you will be able to take a moment and review clinic protocols and standing orders associated with the use of Critline in your facility. When we consider the current approaches that support a successful fluid management program, we should first ask ourselves a few key questions about which has the greatest impact. Do technological advances have the greatest impact? Is it reliance on the clinical expertise of the dialysis nurse? Or perhaps a solid clinical algorithm is the main element to a successful fluid management program? The best, most successful programs rely on all three of these elements. When managing fluid goals, it is important to remember that while standing orders and clinical algorithms are designed with most patients in mind, not all patients fit into a standardized algorithm. Nursing assessment is extremely valuable in conjunction with Critline technology to determine if the patient can tolerate their current rate of ultrafiltration. We know from practice that maintaining an optimal fluid balance in dialysis patients is challenging. An ultrafiltration rate that is too low may not remove enough fluid during a 3 or 4 hour dialysis session, leaving the patient hypervolemic and at increased risk of death, while a UF rate that is too high can lead to hypovolemia and intradialytic hypotensive events. Monitoring the percentage change in relative blood volume can assist clinicians in determining where the optimal UFR for a given patient should land. And if we agree that striking this balance is important, it is important to have immediate access to clinical information that supports decision-making. Critline provides relevant data regarding relative blood volume change, vascular refill, and other key parameters throughout the treatment. The Critline profile will help us determine at which rates the removal and refill are occurring. That data can guide the clinician to intervene if necessary by adjusting the UFR to provide a more effective dialysis treatment. If the ultrafiltration rate, or UFR, is greater than 13 milliliters per kilogram per hour during Critline monitoring, consult the physician, nurse practitioner, or physician assistant to determine if any of the following is warranted: increased UFR, or increased treatment time, or scheduling extra treatment. The goal, as we stated earlier, is to optimize the rate of fluid removal while preventing the common symptoms of dialysis, such as nausea, cramping, and vomiting. Critline provides the clinician with the opportunity to be proactive. Managing ultrafiltration and challenging fluid status is clearly important. Consider challenging the patient's fluid status every treatment. Expert opinion suggests that even patients assumed to be less tolerant of fluid removal, who present with classic signs of fluid overload, should be gently challenged. With data from Critline, clinicians can manage ultrafiltration with confidence. Data from Critline or following the specifics of an algorithm does not necessarily guarantee success. Nursing involvement is key to providing the additional information necessary to drive effective fluid management care planning. Nurses are the voice of the patient during dialysis treatment. They see trends in fluid removal and can communicate any changes. With immediate access to an attending physician, trends in blood pressure and blood volume can be discussed and addressed. Nurses and the entire clinical team are the eyes and ears of the physician during treatment. We are positioned to report findings in real time. We can review the Critline slope with other key findings to predict potential risk and discuss to intervene. And our ability to accurately document and communicate this information is an essential component of managing our patient care planning activities. During this video presentation, you will see the Critline information presented to the clinical team in real time and how the team managed the treatment based on the information received. understanding of the patient's medical history, clinical assessment, and standing orders. The case presented is an example of one clinic's decisions during a patient's treatment. It is included to assist healthcare professionals in forming their own conclusions and is not intended to replace the judgment or experience of the attending physician or other medical professionals. The treatment prescription is the responsibility of the attending physician. Let's take a moment and review the medical history of Patient 1. Patient 1 is a 52-year-old African-American male with type 2 diabetes. He is legally blind. He has a right below-the-knee amputation and wears a prosthetic leg. He underwent a left fifth-toe amputation secondary to gangrene. Hemodialysis was initiated in 2001. He undergoes a 5-hour treatment via permacath with a consistent history of cramping during the last 30 to 45 minutes of treatment. While non-compliant with treatment for many years, he has not missed a treatment in over 4 years. He lives independently at home with maximum home care services. Let's review some of the lessons learned. Without access to the data from the CritLine monitor, the clinical staff would not have had the information to adjust treatment to remove 2,603 milliliters of fluid, 1.5 liters above the initial UF goal set. The CritLine data suggests that the initial goal might not have been set correctly. Initial UF goal calculation is an extremely important step in effective fluid management. The UF goal was challenged per facility protocol, however, based on RN assessment. The staff were able to secure an order and successfully challenge the patient. Clinics were able to rely on the percentage change in blood volume in real time to assess this patient's UF tolerance. So, when the blood pressure decreased to 111/79, the staff were comfortable to change the frequency of blood pressure monitoring rather than reducing the UF goal or administer saline. Without access to CritLine data, staff would not have been able to assess fluid status throughout treatment. Strong clinical evidence supported the change in EDW prescription. Take a few moments and review the clinical protocols and standing orders established by your organization. Please note, unlike outpatient programs, inpatient programs do not operate under standing orders or clinical algorithm. Each acute treatment must have a new CritLine order completed before treatment. Knowledge of CritLine technology and fluid shifting is crucial for the inpatient nurse to monitor a safe dialysis treatment. Let's revisit the valuable tools available to the clinical team when looking to successfully manage the fluid status of the patients. First, we can rely on the clinical expertise of the staff. A nursing assessment is vital when challenging a patient's fluid status. With immediate awareness of any change in the patient's status, including adverse effects, the clinical team can prioritize patient care and support effective care planning. Clinical algorithms provide a playbook or guidance for the administration of a standing order. They provide treatment flexibility when used in conjunction with nursing assessment. FKC offers a set of standing orders that are very detailed and easy to follow. Be familiar with the version of standing orders your physician is using. And finally, CritLine provides the key data necessary to determine patient tolerance of UF goal and intervention to avoid symptoms. Staff benefit from a strong fluid management program. As UF goals and rates are more aligned, staff can spend more quality time attending to each patient. Patient trust can be regained as we work with the physician to challenge UF goals while managing rates based on patient tolerance of the treatment. As patients feel more confident that dialysis will feel more comfortable and they will feel better between treatments, we see that patient satisfaction increases. Gaining access to information offers the ability to be proactive for our patients and can drive our satisfaction too. When patients feel empowered, we all benefit. Patients should be educated so they can actively participate in fluid management activities during and between treatments. Informed patients are often less anxious when challenging UF goals, particularly when they can watch their progress on the CritLine screen. Involved, informed patients can be encouraged to share more information with the staff, which further supports successful fluid outcomes. We should never assume that a patient's lack of knowledge is due to lack of interest. It is important to encourage our patients to learn at their pace and ask questions.